I'm an autism awareness angel, making sure my wings protect the different, the stranger than. I'm an autism awareness angel. It's good, cause I'm cool with the unique behavior. I'm an autism awareness angel. Will you accept me? Cause I accept you. I'm an autism awareness angel, cause a view from the spectrum is a better point of view. The question at hand.
Hello, I'm Tally, and welcome back to Autism 30. Today we are recording from the beautiful PAFN's Good Life Fitness Hub, located in Richmond, British Columbia. And today on our two-part podcast, we are talking with Mr. Keith Landherr from Little Buddies Pediatric Therapy, located in both Burnaby and Richmond, British Columbia, Canada. Keith is a graduate of New York University's Occupational Therapy program and has over 25 years of experience as an occupational therapist. Keith has advanced training in sensory integration, therapeutic listening, neurodevelopment treatment, and is a certified DIR Floortime trainer. He received his feeding and swallowing training from Babies Hospital of New York City and has presented to child development centers in British Columbia and New York City. He has also provided lectures for DIR Floortime Training Program, New York City Department of Education, and Babies and Children's Hospital of New York, and as an adjunct professor of occupational therapy at New York University. Keith has training and experience in treating sensory processing difference in individuals from birth through adulthood, early intervention programs, school-based services, and private occupational therapy clinics. Keith strives to provide family-centered treatment to children and families while honoring their unique histories and individual differences. Keith is currently a PhD student in the Fielding Graduate School for Infants and Child Development, and it's a pleasure to talk with him today. Welcome, Keith.
Thank you, Tally.
Now, what is the history of Little Buddies Pediatrics Therapy?
Little Buddies is a company that we started in November of 2015, which seems like a long time ago, but of course is not very long ago. We started the company to provide family-based services that focused on a relationship-based approach, primarily using a floor-time approach, but we use many other strategies as well. Part of what we were doing was trying to create a space for families that were looking for a relationship-based approach to development that focused on play and engagement, as well as self-regulation.
Which are all really important key factors to helping those with autism.
Yes, I completely agree.
Now, what is the philosophy of your company?
The philosophy is that if we can encourage self-regulation and engagement, that the child will allow us to see what really is in their zone of proximal development in terms of interest and what they'd like to learn next. And part of that is a core belief in that children really want to please adults and they really want to please their caregivers.
That's very true.
And that if you believe that, then what we believe is that when they aren't successful at doing that it must feel really awful for them to not be able to do that, as well as that if they're trying to do that, how can we help them so that they can feel successful?
And those are all really important factors to look into as well.
Yes, I agree.
And what other services do you offer?
Well, we actually only offer occupational therapy at this time. We are in the process of trying to develop a program for having some rehab assistants work as occupational therapy assistants, which can, hopefully at some point allow us to do different types of programs for families. So part of what we offer are different types of assessments
Yes.
based on the parents' needs and desires, as well as funding limitations, which can be a very important part of the puzzle.
Absolutely. And then you mentioned assessments. What do you do with assessments, and why are they so important?
Well, first thing is that assessments are actually required by the college. So we actually get some parents who come in and don't want an assessment and just want treatment, which isn't. The reason why it's important is to get a baseline of where the child is functioning, as well as for us to establish what is in the zone of proximal development for that child.
Of course, yes.
As well as what the goals of the parents are, and what we can do as the next step for achieving that goal. I think that most parents, their goal is for their child to graduate from school and go out and live on their own.
Yes, that is a goal for most parents. Absolutely. And what's included in the assessment, and how does all this become involved?
Well, the assessments can be quite different based on the parent's needs. So if someone's coming in from outside of the Lower Mainland and is looking for a package to take back and have other providers use to shape their intervention, then that's a very complete package, and that one can take about 10 hours of the therapist's time. Usually that includes a motor planning,
Yes.
a sensory processing evaluation, which is done with the parents' input, as well as trying to figure out what their play skills are and what their learning style is as well, because that can be very important in what we choose to do next with the child.
So you're trying to get a complete picture of the child that is in front of you and that you're working with, so that you're getting impetus from the parents in all other aspects and using the tools available to gain a complete picture that you know clearly what you're working with.
Yes, absolutely. And it's interesting that you're saying that, because what that brings up for me is what occupational therapy is really supposed to be about.
Yes.
So it's supposed to be about looking at the biology, psychology, and the social aspects of how we engage in occupations, which really mean activities either of daily living or leisure, and how what those biological, psychological, and social impediments might be to allow them to be as successful as possible. And so when we think of an occupation, we all have very many occupations.
True.
So you have an occupation of being a mom, as being a wife, being a daughter to somebody else, as well as the very typical occupations that we think of that may be involved in a job or running a household as well.
And these are all really important factors to consider in working with the whole child.
Absolutely. And when we think about a child, what we're really working on, if we can help them to engage in play,
Yes.
then they can practice all of these skills on their own. And not to say that, very specific interventions are important in therapy, but if we can get a child to go out and explore the world on their own, then when they come back to us, they will probably be a lot further along, and we will be able to focus on something else, or we'll be able to focus on that same idea in a much more rich and kind of wonderful way.
Absolutely. And I mean, you mentioned play, and I think you're explaining it now, but why is play so important?
Play is very important. So in OT jargon, when I was in school, and I think people still say this, is that a child's primary job is play.
Yes.
That's what their work is. But it's part of normal development. I mean, we get to play. When we play, we get to try out all of these different roles. We get to try out all of these different emotions, and we do them in a fairly safe and secure way. So we can try out what it's like to be angry without, going full throttle and kind of losing all of our self-regulatory capacities. We can also practice out what it's like to be a mom, even if we're only 4 years old, or a dad, or a fireman, and all of these things lead to, if you're practicing being a fireman, you're practicing climbing up a ladder, you're practicing dragging around a hose, and all of these things are just such great things for developing your motor skills.
Absolutely.
Yeah. And your social skills, and even perhaps your ability to negotiate with another human being. So,
And I think you've explained that really beautifully, because I know some parents are very focused in on work and study and whatnot, but what you're describing, play, and actually what play is work and study and development, and by trial and error, really working through a lot of complex ideas, which are really important to the development of a child.
Absolutely. And it also allows you this sense of mastery and this ability to feel powerful, even if you're, not as powerful. If someone else from the outside may look and think that you might need a lot of work at something, it allows you to feel successful, especially when you're playing with a peer, and they just love what you're doing and they're smiling back, and that ability to feel powerful makes you want to try again.
Absolutely. It's an internal motivating factor to want to do good, as you were saying earlier on in the podcast too.
Yeah, and absolutely. And when you keep trying, it usually keeps getting better.
Absolutely. No, I agree. And what types of treatment do you offer?
Well, we offer a lot of different types of treatment. So sometimes, depending on what the age of the child, and the desire of the parents or perhaps the teaching staff, that may play a role in how we develop a program for that child. But I think that we always look at the child in a sort of bottom-up type of frame of reference, and so my belief is that if you don't have the body awareness or the motor planning skills to do something, I try to figure out why you don't have that, because if we can figure that out and we can make that better, then you can probably learn how to cut with a scissor on your own if you really have great use of your hand overall.
And that's lovely. Basically, what you're talking about is you really get to the core of the issue of where the difficulty lies, instead of working outward in, dealing with the fine stuff where that's going to continually need more and more therapy. You're really treating the issue from the core, which actually helps deal with a lot of other issues that could possibly come up.
Absolutely. If you don't have body awareness, then it's really difficult for you to manage not only the external feelings that happen in your body, but the internal feelings as well. And so very often these children will have difficulty with toileting because they don't really know where their bladder is. And when we think about this little tiny sphincter muscle that's allowing you to eliminate, and if you can't figure out where your elbow is, you can't figure out where your bladder is.
And I'm really happy that you mentioned that, because I know a lot of typical parents of typical children don't think about these things, about how a person with autism might feel about their own physicality, their own body, because often, not a mistake, but a miseducation, I would say, happens when people assume that everybody feels the exact same thing, but people with autism may feel slightly differently in their own skins. So to assume that they have the exact same sensations and can analyze them the way they can, there could be miscommunication that happens in those interactions. Am I correct in assuming that?
I think that's very true. And I think that it's really, one of the things that I have the most trouble with is when a child will react to a loud sound and somebody says, "Oh, that's not anything. Oh, you're okay." And because the child's perception is that they're not okay. And if we it's really easy to think, well, we're coddling a child by saying, oh yeah, that was very loud, I'm sorry that hurt your ears. But I find that if you use yourself in that way, and you do it in a calm voice, then the child reevaluates how they've perceived the sensory information. So suddenly that loud sound, it may still be a little bit startling, but I find that the child almost always looks at me and says, as if to say, is this okay? Are you okay with this? Do we need to run out of the room because something really bad is going to happen? Or are we going to be, or are you going to help me through this? And then before you know it, then the response doesn't even become as intense. They might even look at me and kind of smile, and as if to say, yeah, that used to bother me and now it doesn't bother me as much. But if we simply say to them, you're okay, especially when we tend to say that, hopefully we're using a really nice voice, but
Yes.
I don't think we really do. And what that says to the child is, not only does this not make sense, this person is not really helping me to make sense of it, and is telling me that something is wrong. And many times they don't have that kind of gray area thinking to think, all right, my perception is off, and instead it becomes something's wrong with me, and there's something wrong with this, and if no one knows how to fix this, and so they're just pretending that it's okay when it's not, which creates anxiety.
Absolutely, and I love your approach to that. You're very respectful, and I wish more people out there would actually take your approach when dealing with their own children and dealing with our children in particular. I really love the fact that you not only respect the child, but you're actually allowing them to develop confidence in the world around them to help them cope better with what they hear or feel or see.
Well, that's really kind of you to say. I think I wish I could say that I was always that I've always done this 100% of the time. But I remember as a younger therapist, there were times when I became stressed because I guess I didn't know how to help a child. And there's a saying in psychology that under stress we regress.
I love that. Yes.
And I think I probably became a little bit more like some of the caregivers that were stressed by me when I was kind of perhaps misbehaving or having a difficult time, and that becomes basically stop it and don't do that,
Yes.
which doesn't really change the child's perception of what's happening, and until
Yes.
that perception changes, their reality doesn't change. For them, like a very simple noise that we take for granted, it sounds as if there's an explosion or
Yes.
yeah, and to that, like to us, like from the outside, if you look at it, it's like, well, that's not a catastrophe, but to them it is a catastrophe, and they're waiting for the next ball to drop, even though there perhaps isn't another ball waiting to drop.
And I can appreciate that feeling, because I know I'm a serious arachnophobic person, and you can tell me 1,000 times this spider in Canada will not hurt me, I will still want to leave the room. And so I completely understand what you're coming from, and if people model behaviors around me that are calming, I know that does calm me as well in that type of environment, even though they're totally opposite things in dealing with, but the feelings are still there in somebody. And what you're talking about is acknowledging that the person has those feelings in that moment, so that they're gaining an understanding of what they're feeling, not just completely ignoring it.
Yes, and I think it's when we think about it using very basic conflict resolution techniques. If you were at an airport and they just canceled your flight, and you finally got up to the counter to try to rebook, and they said everything's okay, you would not really be very happy. But if they say, so what when people are trained in conflict resolution, they're
Yes.
trained to actually say to you, you look really stressed. I'm really sorry this happened to you. And even though they may not be able to do something, it makes you feel like you've been heard, and now you can solve the problem.
Which is really important.
It's just really important. So when we use that with the lens of a child, it's very much the same principle. So I've seen children get bumped in the head with a scooter board, and the adult says, "Oh, you're okay." And my response is, "Well, why don't I hit you in the head with the scooter board and see if it feels okay?" Because
Yes.
it's simply not. And I find that when I say to that child, that must have really hurt. So do you want to try again, or do you want to do something else? Very often they'll actually try again, because I've said, yes, that did hurt, and I saw what happened. But again, I'm not grabbing you and taking you out of the room and rushing to the emergency room.
Yes.
I'm telling you that you're going to be okay by maintaining a calm presence, but I've also acknowledged that I understand what happened to you. And without that, their perception of what happened is not going to change.
Exactly. Wonderful. Now, I've got a question, which I know many parents out there are really keen to learn. And if you don't know about it yet, I suggest learning about DIR Floortime. Now, can you give us a bit about the history about this evidence-based approach? Because I know many people out there are very curious about this.
Well, it's a great question. I think that I guess I'm starting out with my own history in learning about DIR Floortime. So I did some of my sensory training first, and I did some of the neurodevelopmental treatment approach as well, which is kind of a handling technique for helping people learn how to use their bodies.
Yes.
or to recover from a stroke. And what I discovered is that after I had all of this, the piece that was missing was this relationship piece. And, OTs are supposed to be really great at using themselves. It's called therapeutic use of self.
Yes.
But I think that in more modern times, OTs are not always as good as it, as I should say, as not as good as it as I wanted to be.
Yes.
And so I think that we focus in on all of the evidence-based assessments and modalities that we might use that are really easy to measure. And what I discovered was that something was missing, and someone suggested I go to this Floortime conference with them, and I went, and I was completely hooked, because it focuses on their first state, which is working on self-regulation, and then working on, which is helped with a young child by the mom being attuned to them and helping them to self-regulate and co-regulate, and then working on very simple engagement, and the next step would be working on simple communication, complex problem solving, and you keep going up until you have abstract reasoning skills, which are the highest level. The approach was started or created by Stanley Greenspan, who was a child psychiatrist who worked in the Washington, D.C. area. And so he, and actually quite a few other people, but this primary co-creator was Serena Wieder, who is a speech-language therapist. And so they developed this program, and so what they're looking at are functional emotional capacities, and which are the ones that I just mentioned. And so they start out with self-regulation, engagement, simple communication, and then they go upwards and onward to gray area thinking. And I think very often if we are trying to intervene with a child, we often start with gray area thinking. We start using these very abstract terms that they have no idea what they mean. And I think one of my favorites is the word inappropriate. And so often a parent would say, or even another therapist would say, well, they understand what it means because they stopped. And I'm like, well, do you really understand what does the word inappropriate mean? And it's a interesting word because it's multifaceted and depends quite a bit on your own upbringing.
True.
And perhaps your own culture. But it's also something that changes over time for all of us. And so I don't really think that a 3-year-old, never mind a 3-year-old who's on the spectrum, is going to understand, nor should they understand.
Very true.
And so it might be a little bit better to use a developmental level that is a little bit more appropriate for that child.
Absolutely.
Such as, I don't like when you do that, or, when you do that, it makes me sad. Or even, if the child has very little language and they might have tapped you, pretending to sort of cry and say, "Oh, that hurt," and keeping the communication really simple. But in many ways, it's much more meaningful.
Absolutely.
Because if you're using the word inappropriate, what you're probably working more on is compliance and not necessarily engagement.
Now, that's a really important fact. What's the difference between compliance and engagement?
Well, compliance means that you're following the rules and you're doing what I tell you to do when you do it. Mm-hmm. Engagement means that it's more of a two-way communication. And so I'm looking at what you're interested in and then trying to build on that. And the really great thing about floor time is that the belief is that the more circles of communication, the more back and forth that we have, that the more wiring is going to happen in the child's brain, and then hopefully we won't need to follow them around for the rest of their lives, prompting them what to do next. And I think that when you think about an idea, I mean, so if you have an idea that you've created or that came up in your head, even if someone else has had the idea before, that when you create that idea and then it starts to network out, and we think about it, it's like within one dendrite in your brain, and all of a sudden it starts to branch out and connect throughout your brain. It's richer and in many ways has a lot more structure and takes up a lot more room in your brain than when someone tells you what to do and you've done it.
Absolutely. And what you're basically saying is one really leads to independent thought and creativity, where the other one is basically in a box where they need further guidance and further help to cope with life. And essentially what most parents want are independent children, independent of therapy later on, because that would be the goal. True?
Absolutely. And the negative part of this for parents might be, but you have to take the good with the bad, I think, is that, when children initiate, they don't always do exactly what you want.
Very true.
But the great thing about initiation is that the only way that you can really learn how to write your name is if you pick up the pen and start scribbling. So if I grab your hand and I do hand over hand and write your name, you haven't learned how to write your name. And I've actually had children who the parents say, "Oh, they can write their name," and then I, give them a crayon or a pencil and nothing happens.
Yes.
And then they say, "Well, do hand over hand," and I have my hand on the child's hand and they're looking up at the ceiling. I mean, they're very compliant. They're really happy to let me write their name while I'm holding onto their hand, but they're not writing their name.
And a beautiful thing, though, is when people aren't necessarily compliant, you really learn who they are as individuals. You're not projecting an image on them. You're really learning who they are as the individual people that they are.
I think you're absolutely right, and we get to see exactly where they are right now, what their strengths are, what their interests are, and when we can find out what their interests are, we can shape that into many things.
Absolutely.
And I try never to, or I try to put this on the back burner at least, not to worry too much about repetitive behavior, because I find that when a child is repeating something, they're trying to master something that they're not good at. Or they're using it as an anchor because they don't feel regulated.
And that's a nice reminder to people as well.
Yeah, and I think that I say to parents at times that there are times when I have done something with a child that the thing that I sticks out the clearest for me was there was a child who wanted to roll this ball up a ramp, and we were doing it. And I mean, it was becoming richer and different, but we were doing it for 4 weeks. And his mother said, well, when are we going to stop doing this? I said, well, my experience is that when I wake up in the morning and say, all right, I'm going to talk myself into doing this because I can't believe I'm going to be doing this again, the child walks in the room and looks at me and as if they're saying, why are you doing that? I'm not doing that. I'm done with that. And suddenly they're doing something different. And that's when it really starts to take off and almost explode in terms of how different they become and how many different interests they have.
Which is really good. And now you're talking about the people that you're working with and their relationship with their parents and whatnot. Can you explain to our audience why relationships are so important?
Why relationships are so important? Well, I mean, I think that it's such an important part of development, and there, in one of the big theories in terms of relationships is attachment theory with children, and how important that is, and I think it allows a child to try something out, look at their parents or their caregiver, get feedback about whether or not they were accurate or not accurate, whether or not to try again, and also that they know that, well, if basically if I fall down, somebody's going to pick me up, and if I fail, someone's going to tell me it's okay.
Yes.
And I think that when we all want to be smiled at, we all want to be told that we're doing okay and that we're doing well. What I try not to do with children is I try not to say good job, and part of that isn't that I don't praise them for things. I do that quite a bit, but I tend not to say good job, mostly because the circle of communication is over.
Yes.
And so if you throw a ball to me and I throw it, or I throw a ball to you and you catch it and I say good job, the child will often look or run off and try to do something else, and we wonder why. But we've basically told them that the action is over. Unless the whole motivation is going to be to have somebody say good job to them again, and I don't know whether that is always intrinsically motivating for children. But most importantly, it really doesn't keep the circle of communication going. And so saying, oh my gosh, you're a really good catcher, or you're such a good thrower, even when I say it in that way, you're ready for the next throw, or you're ready for me to catch it again, because I'm telling you, I'm still engaged with you without saying the interaction is over.
And what you're also mentioning is the language that you use to communicate with your child is actually really important, because you might not understand the subtleties of the messages that you're giving the child that you're working with. And one of the reasons why correct me if I'm wrong, relationships are so important is really we go through life from birth to death having relationships with people, and we really need the fundamental basis to master that, so we're able to live independently in the world with other people and not just our parents or our caregivers or therapists that we're working with.
Absolutely. I think that unless I'm going to follow you around for the rest of your life telling you what to do next, then it's not necessarily the best approach. I think one of the things I think I want parents to really know is that, when a child is successful doing something, it isn't, especially if they've only done it once, it's probably not the best time to say, okay, let's do it something a little bit more difficult.
Okay.
Because even if you've said good job, what you've really said is, I said that to you, but that's not enough.
Yes.
As well as when we're thinking about many of the children they have motor planning and skill acquisition difficulties.
Yes.
So perhaps them practicing it a little bit and feeling successful at it is a lot more important than whether or not they're meeting or in age what we might think as being age appropriate for that child based on their chronological age. Because what's most important is like, well, are you doing something different from yesterday?
Yes.
Are you interested in doing something that you tried yesterday? Even that is pretty important. I mean,
Yes.
Many of the kids that we see, I mean, this is sort of a technicality, but many of they changed the criteria for having developmental coordination disorder a few years ago, and before you couldn't have autism and developmental coordination disorder. There were a few studies in the UK that said that it was at least 80% of the children would also qualify for developmental coordination
Wow.
disorder. So part of developmental coordination disorder is that when I tell you to copy me, you can. But when I ask you to do something, trying something that is a bit of a more automatic response, that you can.
Okay.
And it's not to say that there isn't a time when you might not, ask them to copy you, but I tend to do a skill that I know is a little bit lower than what I've seen them do spontaneously. And this could be a very, very difficult thing for parents to understand, because what I hear is, well, he just did it.
Yes.
I think it's just a control issue. And of course, then it becomes a compliance issue. And what the child is really saying is, I wish I could do it again, but I can't. So I'm doing something else, or I'm running over and throwing it against the wall because I'm good at that.
Yes.
And what I ask parents to think about is that when we're having conversation one-on-one, it's fairly easy. But if we think about having that same conversation in front of a group of 200 people or 500 people,
Yes.
or every time you add a number, it gets harder. Or if it's somebody who is an expert at something and you're asked to, talk about that to them, it becomes exponentially harder. And so this is what is happening with these kids all the time, only
Yes.
it's something we take for granted. We think, well, this is so easy. Anybody can do
Yes.
this.
And what I really like is that you seem to have a natural ability to understand the psychology of our children and really pay attention to their feeling of self-worth and self-respect within themselves, and valuing them as individuals, and really taking care of that part of them, as well as learning the therapy needed, the technique needed for them to be able to be independent later on, which I really, really enjoy. And I love the fact that you're educating the parents as well, that to be very mindful of the way you approach your child, including myself. I've learned many things from you here about the way you're phrasing things, which I think is a beautiful thing and something for all of us to be quite mindful for. Now, I'll continue on because I know you offer OT, and I would like you to explain to our audience, what is occupational therapy?
Occupational therapy. So occupational therapy has a very rich history, working many times in psychiatric settings, and in both World War I and World War II, helping people feel like they do have self-worth. And so this isn't related to children, but I really like this story because what they would do with wounded soldiers is that they were often worried about what their buddies were doing that were still fighting, and they really wanted to help them, but yet, they were missing a foot or something of this magnitude. And so what they did, including people who only had one hand, is they figured out ways for them to learn how to knit or crochet socks for their
Yes.
buddies, and so they would sit in bed and they would knit, and then suddenly they realized that there are other things that they could do, and that their life might have taken a very dramatic turn, but there were ways that they could be finding meaning in their life and have, contribute to society in a way that was helpful for them. And so so again, it's looking at the biological, the psychological, and the social aspect of what it takes to engage in any type of activity or interacting with other people, and then figuring out what things are missing and how do we help the person develop that skill, whether it's through exercise or different types of experiential learning, as well as adaptations to either the environment or learning the learning environment, so that they can be successful. And when I think about children in that aspect, I mean, the biggest thing for me is that, one of the things in the educational world is thinking about learning readiness.
Yes.
And so I think that I've seen this with children that are very, very young, and so if they're dysregulated, how can we expect them to learn? Because when we're in that state, what happens is that you may even be successful in completing something or completing a motor plan, but your memory of what actually happened won't really be accessible to you.
And I'm really happy that you mentioned that, because I know myself as being an ex-teacher, I wish that more teachers would actually understand that key factor when dealing with our children in the classroom, because I know that's a common concern that many parents that I've spoken to have about their children being in a classroom where the teacher didn't really understand that key. And I know I'm a strong advocate for more education for our teachers in this province because of the fact that we have a wonderful inclusive education, and that more education, in my opinion, is needed for the teachers. And that one point that you mentioned, I think, is really key. So thank you for mentioning that. And can you please reiterate that one core point once again?
Well, I mean, I do think that it has gotten better, by the way, in the past 20 years in terms of what
I
parents.
Absolutely agree.
And it's because of so many people advocating. But I think that if you don't have a state of learning readiness, that you don't have the capacity to actually retain the information that is given to you. The really nice thing that I see teachers doing now is, and I've encouraged them to think of the kids that we work with as the canaries in the coal mine. So there's plenty of children who are working on compliance, and so those children will look like they're listening, but they're not paying attention to a word you're saying.
Yes, very true.
and so these children are telling you, guess what? 50%, you've lost 50% of the classroom. And so it's probably better that you do a movement break or something or come back to it later, so that you'll actually be successful in teaching this, because you'll go through the entire lesson plan and 50% of them are no longer listening to you.
Absolutely. And I'm really happy that you mentioned that, because I know constantly when I'm going to meetings in school for my son, and when other parents are going into meetings at their educational establishment with their children, the common thing that is always said is what is good for our children from the teacher's perspective is good for the whole classroom, which you just mentioned really beautifully. Thank you for doing that. This concludes the first part of our two-part podcast with Keith from Little Buddies Pediatric Therapy. I hope you'll join us on August 1st to listen to the second part of this really informative podcast. Once again, this is Tally telling you to live in love.
Hey yo, I'm an autism awareness angel, making sure my wings protect the different, the stranger than I'm an autism awareness angel. It's good.